Injuries of the liver. Injuries of the liver, most frequently injured organ in blunt abdominal trauma, susceptibility due to large size, anatomy and position in the upper abdomen, solid nature of the organ, relative inelastic nature, pre-existing disease like fatty change, hepatitis, malaria, cystostomiasis. Second most common organ to be injured overall after brain. Right lobe is injured more 5 times more than left. The lesion occurring more on the convex surface. Resuscitation. Liver may be ruptured during vigorous resuscitation. If the individual was being resuscitated, there will be no blood in the abdominal cavity. HELP syndrome, hemolysis, elevated liver enzyme, low platelet is a variant of severe eclampsia, occurs in a variety of severe eclampsia, occurs in 5 to 10% patients with a severe preeclampsia. In about 1% of cases of HELP syndrome, spontaneous liver rupture is seen. Hemoperitoneum, very common in a liver injury, may be fatal in many cases. The subscapsular hematoma, blood trauma to liver may occasionally strip the capsule. Strips from the capsule from its parenchymal attachment, resulting subscapsular hematoma. Two sequelae may occur. Either in the hematoma will undergo complete organization and replaced by a thick fibrous connective tissue capsule, or bleeding may continue to occur, giving rise to large collection of blood underneath the capsule. High tension capsule may rupture days later, releasing large massive amount of blood into peritoneum, causes sudden death. Complete amputation of the left lobe, severe crushing on the front of the abdomen, as in violent kick or over the abdomen, liver crushed between an anterior abdominal, complete amputation of the left lobe, which may be found freely lying free in abdominal cavity. Clinical point: liver injury can be detected up to 25% of with the blunt trauma when a CT scan is routinely performed. Liver laceration or rupture or bursting injuries, particularly seen in vehicular accidents or child abuse, can be classified in two ways according to the depth and according to the site. According to the depth, transcapsular laceration, that both capsule and parenchyma are torn. Subscapular laceration, capsule is intact, liver injury is just beneath. Intraparenchymal laceration deep inside the parenchyma, so it does not communicate with the surface. Then according to the site, that is a coronal superior surface laceration due to distortion, laceration inferior diaphragmatic surface due to distortion, coronal and inferior surface very common in vehicular accidents. Counter coupe laceration, when liver is caught between vertebral column on the back and trauma bearing anterior abdominal wall on the front. The laceration occurs on the posterior surface, this surface, diametrically opposite the which receives the trauma, that is counter coupe. Thank you.